Propranolol. It is a non-selective beta blocker that is highly lipid soluble and easily crosses the blood-brain barrier. The tremor that disappeared before the speech. A 22-year-old medical student's hands shake minutes before his most important presentation. His professor gives him a single tablet. 30 minutes later, steady hands, slowed heart rate, confident delivery. How can one medicine simultaneously reduce tremor, palpitations, and the physical symptoms of anxiety? The answer is propranolol, a non-selective beta blocker that blocks both beta 1 and beta 2 receptors. Mechanism of action. Propranolol blocks both beta 1 and beta 2 receptors with equal affinity. First, beta 1 blockade occurs in the heart and kidney. In the heart, propranolol decreases heart rate, reduces myocardial contractility, and slows AV conduction, thereby lowering cardiac workload. In the kidney, it inhibits renin release, leading to reduced angiotensin II formation and ultimately lowering blood pressure. Next, beta 2 blockade affects the lungs and liver. In the lungs, it causes bronchoconstriction, which is why propranolol is contraindicated in patients with asthma. In the liver and splanchnic circulation, it reduces portal pressure and hepatic blood flow, making it useful in portal hypertension to help prevent variceal bleeding. Finally, propranolol has important CNS effects. Because it is highly lipid soluble, it readily crosses the blood-brain barrier and reduces central sympathetic overactivity. This central action contributes to its effectiveness in conditions such as essential tremor, performance anxiety, and migraine prophylaxis. Clinical uses. First are the cardiovascular indications. Propranolol is used in hypertension, angina pectoris, and supraventricular tachycardias. Another important indication is migraine prophylaxis. Propranolol is a first-line treatment that significantly reduces the frequency of migraine attacks. It is also highly effective in essential tremor, where it reduces involuntary shaking by blocking peripheral beta 2 receptors in skeletal muscle and reducing sympathetic overactivity. In thyrotoxicosis, propranolol provides rapid symptomatic relief by controlling palpitations and tremors. In addition, at higher doses, it inhibits peripheral T4 to T3 conversion. Finally, propranolol plays a major role in portal hypertension. It reduces portal pressure, thereby helping prevent variceal bleeding, one of the most serious complications of chronic liver disease. Adverse effects. The cardiovascular adverse effects include bradycardia, hypotension, and heart block. These occur because beta 1 blockade slows the heart rate, reduces myocardial contractility, and delays AV nodal conduction. The most important respiratory adverse effect is severe bronchospasm due to beta 2 blockade in the airways. Therefore, propranolol is contraindicated in patients with asthma and severe COPD. Because propranolol is highly lipid soluble, it crosses the blood-brain barrier and can produce CNS adverse effects such as fatigue, vivid dreams, nightmares, and depression. Among the metabolic adverse effects, propranolol can mask hypoglycemia symptoms, especially tachycardia in diabetic patients. Finally, peripheral beta blockade reduces peripheral blood flow, leading to cold extremities, particularly in patients with underlying peripheral vascular disease. Contraindications. Before prescribing propranolol, always remember its key contraindication. The most important is asthma. Why is asthma dangerous? Because beta 2 blockade causes bronchoconstriction. In asthmatic patients, propranolol can trigger life-threatening bronchospasm. Therefore, propranolol is strictly contraindicated in asthma and should also be avoided in severe COPD. There are a few other situations where caution is essential. In diabetic patients on insulin, propranolol can mask hypoglycemia, especially the warning symptom of tachycardia, making low blood sugar more difficult to recognize. It should also be avoided in patients with heart block or severe bradycardia because further beta 1 blockade may worsen conduction abnormalities and excessively slow the heart rate. Finally, use caution in peripheral vascular disease as reduced peripheral blood flow can worsen cold extremities and symptoms of limb ischemia. Key takeaways. First, remember its dual impact. As a non-selective beta blocker, propranolol blocks both beta 1 and beta 2 receptors, affecting both the cardiac and respiratory systems. This explains both its therapeutic effects and many of its adverse effects. Second is its CNS efficacy. Because propranolol is highly lipid soluble, it readily crosses the blood-brain barrier, making it effective in conditions such as essential tremor, performance anxiety, and migraine prophylaxis. Third, propranolol has diverse applications. It is used across multiple specialties for hypertension, angina, migraine prophylaxis, thyrotoxicosis, and portal hypertension. Finally, always remember the critical cautions. Propranolol is strictly contraindicated in asthma because beta 2 blockade can cause life-threatening bronchospasm, and it can mask hypoglycemia in diabetic patients receiving insulin.